Telemedicine has become a go-to now for so many people who are seeking a doctor's care but don't want to go into the office. But there is a limit, though, to how many calls a doctor can make in a day with just unprecedented caseloads. Some physicians in San Antonio and around the country have been turning to a new technology that uses artificial intelligence to reach the masses in real time. And tonight, as News 4 troubleshooter April Molina reports, the same information could also be relayed instantly right to the CDC.
Resources are scarce, doctors are overworked, and patients are scared, left to battle the deadly virus, in many cases at home alone.
In a massive quarantine situation, it becomes very hard for doctors to stay connected with their patients.
Imagine a doctor being able to track thousands of patients a day through artificial intelligence. Dr. Marcus Gitterly, who serves as a development advisor for Careexpand and also uses it with his patients, says it is the single greatest innovation for at-home care in a pandemic.
It seamlessly links that remote patient monitoring with telemedicine, and by uniting them, I can keep track of and respond to many patients.
Michelle Seidel is one of his patients. She is also a nurse practitioner and a single mom. Just last week, her temperature began to rise as she was headed to work.
It was enough elevation that it was somewhat worrisome, and I had developed a cough in the middle of the night and overall just fatigue and not feeling well.
Seidel was tested for COVID-19 and has been caring for herself at home ever since. She has also been isolating herself from her 14-year-old son to keep him from getting sick.
Do you feel a little bit like it's a lifeline for you when you're at home having to care for yourself?
Can be, especially when you're all by yourself if you don't have anyone else there with you.
The app is simple and user-friendly. You can send your daily response online or via text message on your cell phone. Seidel says it literally takes less than 1 minute to do.
It has been comforting too with the system they have set up, because you get a daily check-in. So you feel like you have that connection with your doctor every single day.
Doctors can then leave comments or give recommendations without even picking up the phone. The information you share on the Careexpand app could ultimately be shared with the health departments and the CDC in real time, allowing them to monitor symptoms and patterns. Gitterly says Singapore utilized similar technology, which helped them track COVID-19 and allocate resources.
So we can see, oh boy, we've got 10 new patients in, this town and, 20 here. And you can follow that wave of patients and you can see those clusters developing. So it only remained to just throw engineers and time at it. And that's what we began to do.
The more patients and doctors that use this app, the more impactful it will be in detecting the next wave of the pandemic. I'm News 4 troubleshooter April Molina.
Now we have links for both patients and physicians online if you're interested in signing up or learning more about Careexpand. Now, during the pandemic, there will be no cost to physicians. As for patients, the doctor says Medicare and many insurance companies are covering this as a telemedicine consult.